one of my key anti-aging ingredients would be vitamin A. Now, vitamin A comes in 3 different forms. You get your retinol palmitate, which is the least aggressive form of vitamin A, and you will mostly find that in all skincare brands, or most of them, even in sunscreens. And the main purpose of this is to be an antioxidant, so it fights free radicals. Then one that's stronger is retinol, which is the fat or oil-soluble form of vitamin A. And retinol is mostly used in the skincare market up until about 1%. But these days, they also formulate your retinol where they put the active ingredient in a small capsule. And with it being encapsulated, it doesn't cause irritation on the skin, and they can then push it up to a much higher percentage because as it penetrates into the skin, it's only released once it gets into the deeper layers. In the old days, people would have quite not severe reaction, but they would have a reaction to retinol where the skin will go red, it will go dry or dehydrated. Now, today's formulations, I find it just so much more sophisticated with hydrating ingredients and being maybe that they encapsulate the vitamin A or the retinol. Now, why should you invest in a retinol? Because when we look at clinical data, 1% retinol applied to the skin has an effect on the fibroblast within 48 hours. So within 48 hours, that retinol is working on the fibroblast, the cell that makes your collagen, your elastin, and your glycoaminoglycans. And that's why it's such a popular anti-aging ingredient. The strongest form of vitamin A is retinoic acid, and retinoic acid can only be given to you by your doctor. Your doctor will do a prescription for you. Most of these come in different creams or gels with different brand names, but it's anything from a 0.025 to a 0.5% that is given. This is slowly introduced in the skin. You will get that retinization process where the skin will go red and dehydrated and dry and a little bit sensitive, normally for about 2 weeks. And therefore, most doctors will slowly introduce it by giving it to you to use once a week, then twice a week, then 3 times a week, and eventually you'll just use it until you use it every night. Your prescription vitamin A is normally given to be applied at nighttime because at night the skin really rejuvenates and repairs all the damage that's incurred during the day. But also with this type of vitamin A, it can thin the superficial layers, specifically the stratum corneum of the skin itself. Same way something like a Roaccutane would do, which is your strong form of vitamin A that's taken internally and therefore affects the body and the skin. Whereas your retinol, that is still actually safe to use in the day. So retinol palmitate and retinol can be used in the day. Now, I've read a medical paper where clinical data prove that applying any form of vitamin A on the skin does not make your skin photosensitive. So what that means is it doesn't make your skin burn quicker than what it should. Whereas alpha hydroxy acids actually makes your skin photosensitive, so that means you will burn quicker than you normally would. For this reason, I have been using my retinol every day, and I apply it in the morning underneath my moisturizer because I want to get that antioxidant benefit as well. But in a nutshell, vitamin A is a wonderful ingredient to use when you are battling with hyperpigmentation, with mottled pigmentation or uneven skin color, with a rough skin texture or uneven skin texture, and of course fine lines and wrinkles. It's one of my key actives that I could never go without. And after the age of 30, I think everybody should invest in some form of vitamin A.